Hello. If you know anyone who has kidney issues, who has kidney failure, I want you to help me tag them in this video or forward this video to them. Because in this video, I'm about to explain 5 key things that they must do if they're going to survive this condition. I have testimonies of people who have lived for 10 years after being diagnosed of kidney failure. Okay, you too, or the person that you love could also be among these people that will live a healthy, long life, even though they have been diagnosed of kidney failure. One of the things that you need to do when your doctor tells you that what you're going to be needing is dialysis, the first thing you're going to do is to get an access. An access is a link that a person who has vascular access is a link that a person who has kidney failure will be using for dialysis. We have the ones we call the emergency access. Okay, we have the one they do femoral, they do in between the legs, but that's not the one I'm talking about. If you've been diagnosed of kidney failure or your loved one have been diagnosed of kidney failure, it is very important that you ensure that the person gets the central venous catheter at least, or the person should go for the AV fistula. All right, AV fistula is actually the gold standard, but if you can't get the AV fistula, it's actually very important that you get the central venous access. This is going to help you to do dialysis as at when due without being punctured every now and then. Okay, too much of puncturing on its own has a lot to do with whether you're going to survive this condition or not. All right, so because you also have the mind of doing transplant later, even if you don't have the money, God can actually raise people to help you do the raise fund for transplant. And when you eventually do the transplant, if you've been using the one they call femoral catheter, femoral cannulation, that is that has so many negative effects in your body, you may actually be putting yourself into more danger even after the procedure. All right, that is number one. So number two is that you need to take your labs very, very serious. And we're going to be looking at two labs in this very conversation. If you've been diagnosed of kidney failure, all right, one thing you're not going to be joking with is your labs. I used to tell people to do their labs every section of dialysis. Every section of dialysis they're going to be doing, they should actually go for lab investigation. That's to do their urea creatinine investigation or the kidney function test, depending on what you call it in your facility, and also do PCV to know the volume of blood, to know the level of blood that you are having per time. These two investigations are very, very paramount if you're going to survive CKD, all right, if you're going to survive kidney failure. So, because your lab vitals, your lab figures, your kidney function test figures, the sodium, potassium, they are markers. They are very good markers that that's going to actually be used to know if you're going to live long on dialysis, if you're going to survive this condition. Okay, so the plan is to make sure that these values are within normal range at every given point in time, or even if they're not within normal range, they should be close to something that is normal, because when you keep having some of them very high or very low, it could actually be a problem. It will also guide your nephrology nurse, your nephrology doctor, the people working with you in the dialysis unit, to be able to gauge your treatment and to know what you actually want per time. All right, these are the things that are necessary. Then the reason why you're not checking your PCV, your blood volume, to know the amount of blood you have in your system per time, is that it's going to help you to avoid loading yourself with blood infusion every time you come for dialysis. Because one of the problems that people who have CKD usually have is that they have low blood level. And this low blood level can actually impact a lot of things. By the time you keep receiving blood every time you come for dialysis, it's actually going to be an issue for you. Although there are people this works for, especially in case of emergency. But when it's not an emergency and when you can actually do something about it, you better start acting fast. There's a medication that your doctor or your nurse will actually give to you in the dialysis unit that will help boost your blood. There's something that the kidney actually produces that stimulates the erythropoietin that stimulates the red bone marrow to produce hormones, and that is called erythropoietin. So they're going to be giving you a synthetic erythropoietin that can actually help perform this work. Then the third thing that you're going to also pay attention to is your diet. So your diet is also keenly attached to the results you're going to be getting from your kidney function test results. If you're going to get your diet right and all these other things I've mentioned, you are also going to actually survive this condition. All right, the number 4 thing that you need to do to be able to survive this condition is to locate a center. It is not okay to be jumping from one dialysis center to the other. I know a lot of people who they started dialysis in in A hospital, and before you know it, they're in B hospital, they're in C hospital. If you keep moving around from one hospital to the other, there's every likelihood that this condition may not be of the best to you. Okay, you need to have a hospital where you're dialyzing that is close to you, so that you'll be able to have access to the dialysis units whenever there is need for it. Then, if there's a better place, maybe a place where you have more qualified people, you can be going there once a month or once in 2 months to know how your system is doing and also to compare. But that means the maximum you can actually have is just 2 hospitals instead of jumping from one place to the other. And one should be the place where you do your normal dialysis on whenever it is time for you to do dialysis, and the other one is for you to go for more expert care. Then the last but not the least is that when you've been diagnosed of chronic kidney disease or kidney failure, it's very, very important that you ask them what the level of your EGFR is. The level of your EGFR is also going to be very important in your management, because it's also going to tell a lot of things about what you're going to be doing and what you're going to be avoiding. So if you know your EGFR, it will help you. So normally when someone has EGFR less than 15, we actually recommend that this person does dialysis at least 3 times in a week. So most centers have their maximum amount of time you spend on a dialysis machine as 4 hours. That means if you're spending 4 hours in 3 days, it should be about 12 hours. This is what your kidney does 247. So it's called that even this 4 hours 3 times a week is not usually enough. So having noted that, you need to also have in mind that you need to work extra hard. There are a lot of other restrictions and other things that you need to do, but these are the top things that you need to do. Let me add more one. Your water consumption will also play a very important role, because at this point you'll be asked to you'll be restricted from drinking excess water, and you also be restricted from taking also have salt restrictions. So these are the things that you also put into cognizance to be able to come out strong from this case. I know the kidney failure is a very bad it's a very terrible diagnosis, and a lot of people, when they are diagnosed, it causes a lot of psychological issues, okay, especially for you and your loved ones. In fact, it throws the family into a very serious state of psychological impact, let me put it that way. But one thing I would tell you is that you need to be strong. A lot of people have actually survived. A lot of people are surviving. So if that's your case, I believe that God is going to come through for you. And as you're following this step and you're hanging on, God's going to give you a miracle. It could be a miracle of transplant. It could be a miracle of total kidney replacement spiritually. I believe in miracles, and then there's nothing God cannot do. If you've watched this video to this point and this video have blessed you, I want you to click on the like button, drop your comments how it has actually impacted you, and also make sure that everyone you know who has kidney issues get in touch with this video. Make sure you do it and you're saving a life. Thanks for watching. I am Onovo Victory, and I'm your kidney